Welcome to another episode of African Farmer Voices, strengthening pharmaceutical systems to improve access to healthcare products in Africa. I'm a believer of the power of businesses to unleash the value of economies in terms of economic development, but also to improve access to care that people need in their ecosystems. And that is why when I look at it from a pharmaceutical value chain, my question has always been, how do we make businesses within the pharmaceutical industry and the healthcare industry at large to be able to unlock value in terms of the economic prosperity that would be possible within the company, but also from a social and political dynamic in terms of driving human progress and human growth in whatever domain that we are operating in. So, guided by that particular conversation and that kind of understanding, I've always been keen in terms of understanding what are the key levers of control and levers of growth that we could unlock and actually use within the pharmaceutical industry to deliver value. And not only deliver value in terms of economic returns within the short term, but looking at it in terms of delivering value in the long term, sustainable business model within Africa. In the last 3-4 years, we've all seen the kind of movements that have been happening within the African landscape, with the exits and actually mergers in some of the cases, or transition to distributor model with most of the bigger multinational companies within the continent. In some of these moves, when they happen, their jobs lost, the access gaps that actually are made emphasized and amplified within the market. And these are problems that we have to contend with in every single day, in every single week of the day, when we see what's happening in that market. Subsequently, then, I got into spaces where I'm having conversations with people, I'm learning from other people and trying to see what are the key drivers of investment and actually business within the continent of Africa. And why is it that we always have this cyclic move where companies will enter into the market, operate for a period of time, then also ultimately exit? One of the key conversations that we've had and some of the observations that I've noted is that there's always the perception of unstable regulatory regime and unstable markets. And therefore, with those instabilities and market dynamics and movements, then nobody is looking at investing in that ecosystem and in that market for the long term. So when you invest and you're not so sure of how the market dynamics will play around uncertainty, then chances are you don't invest with a long-term commitment. But even those who invest with a long-term commitment, the question they keep asking is, are we investing from a business dynamic or are we investing from a social impact imperative? I believe we can do both. Why do I believe we can do both? Because when I look at the ability of a company and organization to operate in a particular market, I look at it beyond the business aspect from a market dynamics only. Looking at the suppliers and the customers that you're serving and dealing in between within that clear value chain. It is the most realistic and actually the most straightforward, because then you know if I bring a product today, the supply is reliable and customers believe in its value and they're paying for it, ultimately then I'm making money. And that is a clear measure of what success looks like from a business perspective, which is good. But what is critical for me in this conversation is around looking at what are the non-market strategies that company can deploy and can use to ensure that they harness the value within that ecosystem, but also kind of de-risk from these cyclic movements, especially from a geopolitical landscape, but also from a policy dynamics within the markets. And if you know from some of the conversation that I've had in the previous engagements and previous episodes, I've been looking at how do we kind of strengthen our regulatory and policy landscape, but also what can we do as professionals working within the industry to ensure that there's a robust and enabling policy environment, responsive but also market-driven policy landscapes. And this stems from my work within professional associations, trade industry groups, and sector health boards. I worked with the Kenya Healthcare Federation as my first job when I graduated from my undergraduate pharmacy school. Then transitioned to Kenya Association of Pharmaceutical Industry, ultimately to the pharmaceutical industry within the company. But at the same time, I was serving as a board member within Kenya Association of Pharmaceutical Industry. And the reason as to why I engaged in these industrial groups and still continue to participate is that I believe that if we would come together as industry players and companies to shape the market within which we're operating, engaging with patient groups, engaging with stakeholders, but also engaging with the government to shape the policy landscapes, then we're able to de-risk ourselves from these regulatory regimes where the policy changes keep coming and the policy inconsistencies then become a pain for the business. But there's need to do more. Why do I say there's need to do more? From these trade associations and policy groups where we engage, most of the work is around looking at what is the immediate challenge from an operational standpoint, and therefore then the discussion, the resolution that are being made are focused on addressing the immediate short-term outcomes and challenges that businesses are facing. In a way, we are using the non-market strategies to address short-term operational market forces. I don't think that would be the key value of having non-market strategies and working within collaborative nexuses within the industry groups. So we need to rethink that model of operation, and we need to think that strategic outlook on where we need to operate. That is number one. On the second end, when you look at most companies, wherever they are, how they operate and engage at the local level within the African landscape, we have non-market strategies. These would come in terms of the access principles and access products, packages, and all that, which are coming into the market, which is amazing to have because they are addressing a need that is in the market. But the question that I keep having and I keep contending with is, how much are we using these non-market strategies to unlock value within the commercial value chain, but also to create a pipeline of value that can actually be tapped in from a market perspective, from a business standpoint, but also creating a value chain within the market in its essence, where new investors and new entrants can operate and play value that actually unlocks extra potential within the market. I think that is a gap where we have, especially when you look at most of the corporations, when you look at the functional structures of these organizations, is that there are people who would be engaging from the non-market strategy aspect, who would look at it from a corporate affairs, market shaping, and all that. They will do a lot of work with different industry players and stakeholders, which is commendable. But when they are doing that, some of the times it is delinked from the core business imperative or the operational excellence that we see within the market operation. For example, if a company has an access bucket and a company has the core molecules that they sell from a market strategy where they're making the profits, you'll realize that the deprioritization comes from operational excellence in delivering the non-market priority medicines. So ultimately then it means these other non-market strategy, which is keen on delivering products to the people who need them, at cost or even at the bare minimum in terms of value access, is not being harnessed. The patients will never see the products, or if they see them, they're not getting them at mass, and therefore then that becomes a barrier for them to utilize the other value and actually to position the brand as a reliable partner within the market, because that is then what will unlock the next imperative for the regulators to see, as a company, are you offering more than you are taking in this market, and what kind of levers do you have? And the pain point at that particular moment is teams might be lean, and therefore we don't have teams on both sides that are interfacing and engaging and sharing learnings across that ecosystem. But also beyond that is, how do we engage with the regulators, and where do we engage with the regulators? And the business has a critical imperative to do that. Unfortunately, I've also noted that some of the gaps that do exist are not only from industry players but also from the regulatory landscape, where we have a regulatory regime where development partners are depended on in terms of helping shape regulatory frameworks and regulatory principles on how things are going to happen in the market. Is it a good thing? Partly yes, in terms of resourcing for the immediate need, but also it introduces additional risk for the company in the sense that what are we doing in the long term? And my proposal from a regulatory standpoint, I think regulatory agencies need to set up structures where they have a robust corporate affairs department, and that corporate affairs department should have reporting lines where we have strategic partnerships, we need to have scientific offices, and general land market regulatory intelligence and market shaping priorities and imperatives. The essence of it is that regulatory authorities do not do the innovative work of developing new solutions and bringing new solutions to the market. But ultimately, they have a responsibility of enforcing regulatory regimes that will ensure consumer protection, that from a competitive policy perspective, employee welfare and employer welfare needs to be addressed, but also in driving regulatory oversight to ensure that harm is not inflicted on the people, and that regulatory frameworks do exist for new innovations and new therapies that are coming into the market. At the moment, regulators are at the mercy of innovators and companies, which now brings a kind of, I would say, power imbalance. That power imbalance introduces a risk to the public, but also impedes on the ability of the industry to bring innovative new molecules into the market. Where do I look at this? Currently, there's a lot of conversation around gene therapies, advanced therapies, and medicinal products. We are moving towards precision medicine globally, which means new medicines that are being developed are going to be more novel therapies from a biological standpoint. In the African landscape, do we all have the infrastructure and the capabilities to venture into these medicines as at now as we are speaking? But this is an opportunity for us to understand that with information sharing and information data pools, we can leverage on existing frameworks and actually domesticate some of these and create that ecosystem where we can do such research in the continent. We can have regulatory frameworks, but we can also open up the landscape for new investors and new players to get into the market. That is value that we can harness. The question is, how do we harness it? It needs strategic, imperative engagements. And I think there's value for us to harness across that value chain. So, from a regulatory standpoint, but from industry perspective, the other key thing that I feel industry has to do so much more of is ensuring that the local operation offices, especially for the multinational corporations, most of the times I've seen where companies have their corporate affairs departments led from the global offices, which are making strategic decisions and market strategic imperatives for how the business is going to operate in emerging markets. It is good to have those at the high level, but these need to be distilled to the country offices, where then the market teams understand what are the other non-market strategies and how do we have a consistent communication. Because in non-market strategies, it's not about the value in terms of financial return, but rather the information flow, the trust that we are building, the consistency behind the work we are doing. If we have a non-market strategy that we roll into a market for 3 years, and within the 3 years, even the local country offices do not understand what the value of that particular offering or service stream in the market is, they will never talk to people about it. They will not make it be a conversation starter across industry groups and industry negotiations. So ultimately, then we are losing value, but at the same time, we're investing substantial in resources in terms of financing, engagements from logistical perspective, relationship that we are building. And the risk of it is, if I make a discussion today with the permanent secretary in whichever country at the Ministry of Health level, and we agree that we are going to facilitate an access pipeline to address maybe, let's say, for example, cancer care, the expectation of that particular politician or leader in that particular context is we will deliver on that imperative, the medicines will be available. And that means we need a local person, a local contact who will be managing that channel to ensure that, yes, we had an agreement from an MOU perspective. Do we talk with the supply agency to ensure that the medicines can be supplied in that country? And when they are being supplied, what is the remuneration structure going to look like for us to be able to serve that market? And are we working within the confines of what profit levels or margins are we discussing or what we agreed on? If that happens and we deliver on one within the first 3 or 4 years with that particular entity, that is an opportunity to roll in new products. We are building that trust. With that trust, these government official, this leader, whoever it is, and even the general agency believes that as a reliable partner and a stakeholder, we are there to help them deliver on their imperative. That unlocks value. And I think we've not been able to mainstream the non-market strategies, especially in emerging markets. And the reason of it is most non-market strategies will require resourcing. And those resources then means somebody has to invest on it. With kind of a shrinking budget portfolio that is available for such kind of work within companies, we might relegate them, but relegating them is actually shooting ourselves on the foot, because then we are missing out on the opportunity to harness long-term value in the next 5-10 years that we are able to, because of the non-market strategies where we invested at the initial moment. And I think that is going to be a critical game changer for where we are. When I look at it from a local pharmaceutical industry perspective, I think there is work that we are missing out on. At the current moment, following the last stop order that the US presidency, that Donald Trump action initiated, where USAID funding has been stalled, there's a lot of conversation from industry groups, from professionals, from NGOs. Everybody's talking about the harm of this in African landscape, especially for HIV/AIDS patients who have been reliant on USAID funding for most of these donor-funded programs. I acknowledge and I believe it is a pain point and it is a worry. But the other key thing that is critical is, how do we drive sustainability and self-reliance? Because that was the principle behind this pronouncement that was made and the decision that was made by the US president. So when you look at it from that standpoint, then it means reliability and self-reliance come from a point of, do we have the manufacturing capacity? Can we look at the financing mechanisms? Can we engage and see what alternative pathways do exist? That is where I feel the non-market strategies are not working, in the sense that we have local manufacturers in the continent who have been able to supply some of these medicines. For example, in the Kenyan landscape, we talk about Universal Corporation, which is WHO pre-qualified for manufacture of some of the antiretroviral medicines. How much of their produce gets to be procured for use in the local continent, whether for HIV/AIDS management? What possibility do they have to expand their production line and actually then create an incentive where we might not need to expend so much money in importing these antiretrovirals, but rather we can buy them from local players? This is an opportunity for them to shape the conversation and say, these are the key products that we were able to manufacture for antiretroviral pool. These are the key non-market barriers, whether it's a procurement issue, whether it's a financing issue, whether it's a policy imperative, and also the regulatory bottlenecks. So then we shape the conversation. The patients are complaining because they are scared of not getting the medicines. If you can assure them that you can offer that medicine, the question then is, how do we make them able to get the medicine through your pathway? And this would create an imperative and an impetus for us to invest in the local manufacturing capacity. I'm not seeing that action happening, which is a worry for me. And using that conversation from the Federation of Kenya Pharmaceutical Manufacturers, Federation of African Pharmaceutical Manufacturers, we can use it to engage with the African Union and all the different agencies within the continent. At a national level, we can leverage on the trade associations to see what conversations are we moving and with who are we moving them. Then ultimately we'll be able to drive it to a next conquest where we are harnessing that value, but also looking at how do we shape a market beyond what is currently happening, rather than focusing on our value streams where we are selling products and we are producing them. Supply and sale, that is a market strategy. But the long-term imperative of a market is to create a market where it doesn't exist, to develop the regulatory pipeline and imperatives for that policy landscape, but then deliver value and harness that value consistently by engaging with your customers and shaping conversations around them, but ultimately converting that relationship to a business driver for economic success. These are some of the key things that I think we need to do from an African perspective, from an industry perspective, to mainstream our non-market strategies. And I would be keen to have more conversation and all just to hear from you as well what you think of this and what do you think we can do in a different perspective. From an African Pharmaceutical Network perspective, we are keen on seeing how this conversation can be seeded in the right forums, in the right engagements with the right stakeholders, so that then we start unlocking that value. We start driving a consistent strategy and conversation within the continent. If that happens, we will deliver our value and we'll be able to harness that possibility for a reliable, sustainable pharmaceutical industry in Africa. Thank you so much, and let's keep engaging.